Okay, hi everyone. Okay, I think maybe we start in a while before we get the full audiences. Okay, okay. It's the right time to start. Okay. Salam sejahtera and good day, everyone. So thank you for joining us today in the Science Cafe. So before we go to the session today, let's have a brief introduction on what is Science Cafe is about. So the YSN ASM Science Cafe, it is a program under the wings of Science Communication at Young Scientist Network and Academic Science Malaysia. And usually it's held in three cities, which is Kuala Lumpur, Penang, and Johor Bahru. And we often have it in a cafe settings, but then due to the MCO and COVID, so we're doing it live Facebook. Okay, the aim of the cafe is to empower researchers to be better communicators, as well as to share their findings to the audiences, especially to non-expert audiences. So without further ado, the topic for today is life with COVID-19 after MCO and assessing risk and making decisions. The session will be chaired by Dr. Siti Khayriyyah, a lecturer from USM and also an affiliate of YSN ASM. And then there's a two housekeeping announcement. So feel free to post your questions in the comment box, and also there'll be a survey after the session, so we need your feedback for further improvement. So without further ado, I pass the session to Dr. Siti Khayriyyah.
Thank you for that introduction, Taiga. So Taiga is actually one of my collaborators in TB research, so a little factoid there. Thank you to the Penang Science Cafe and Young Scientists Network ASM for this platform. And of course, to all of you who are joining us today on this panel discussion on life with COVID-19 after the MCO, assessing risks and making decisions. So Taiga, if you could pull up the slide. So the first slide that you'll see is a picture of me. I don't know if you can recognize. That's me under a mask being out and about now that we're in PKPB or conditional MCO. It's just, enjoying myself. And when you look at that picture, I wonder if you're thinking, what is the risk of me actually catching or spreading COVID-19 if it was around? And if you look at the box that appears underneath, I don't actually fit in any of them because I'm not at home alone or with my housemates. I'm not outdoors. I'm actually indoors, but I'm also not at a gathering. And you can't tell from the picture, but I was actually having lunch at some point where I took off my mask and I was with somebody who's not from my household. And of course, we were at the physical distancing requirement as the SOP, but you would say that my risk of catching or spreading COVID-19 is actually fluctuating throughout the day. And I think that's what the whole point of this Science Cafe discussion is about. The idea of risk during this COVID-19 pandemic is quite unique, and it's really hard to put it in a black and white or in a specific box. It's very dynamic and very context dependent as well. So as we resume life with COVID-19, it's difficult to only stick to the basic calls of preventions. They're still really, really important, hand washing, keeping distance, but we know more about the virus now than we did before. We know now that even though it is still mainly spread through direct contact, we know that it can be spread through air if there's low ventilation or poor ventilation. We know that things like sunlight can reduce the risk, covering our mouths and nose can reduce the risk. And it gives us some nuance on how we can assess our risk as we go about our daily lives under this new norm without a cure or a vaccine. So to explore these ideas with me are the two lovely people that you see on the screen as well, Aidonna Jan Ayub and Gregory Ho from Khazanah Research Institute. Welcome and thanks for coming all the way from KL to be with us on the Penang Science Cafe. Jan is a Deputy Director of Research at KRI, and she specializes in international trade. And she actually co-authored a working paper on trade during a pandemic earlier in the outbreak. And Craig is a research associate at KRI, and he specializes in complexity economics, mathematical modeling, and networks. So, for full disclosure, Jan and Greg, as well as Dr. Hafizwan Rosli from USM, who unfortunately couldn't join us today, are actually my co-authors for a recent publication or a working paper that we released called Dancing with COVID-19, Public Health Precautions Beyond the Movement Control Order. So Jan and Greg will be sharing with all of us today some of the findings of that study to give us some background for the discussion further on. So, without further ado, Jan, can you tell us a bit about the motivation and the approach that was taken for this Dancing with COVID-19 study?
Yes, thanks for having me. Basically, this started with us reading an article on Medium that looked at the epidemic curve from a perspective of two phases, which is called the hammer phase and the dance phase. So the hammer phase is basically where we take strong measures to flatten the curve, which I think most of us are familiar with. And then we have the dance phase where we try to ease the restrictions, but we balance it out with other public health interventions to ensure that the R naught remains below 1. Basically, what we're looking at is to get our transmission rate to remain low. The purpose of why we did this study is to raise awareness on how life after MCO may look like. Not a lot of studies have been done on this phase from a public health perspective, and we thought we could make a good contribution in understanding the issues at hand. We also wanted to gauge the extent of risks that we are facing in this dance phase. And how we did it, we basically did a mathematical modeling exercise. Specifically, it's called an augmented SEIR model, which is a common epidemiological model for projecting infectious disease that we modified to better represent what we see in terms of COVID-19 for Malaysia. We also conducted a brief lit review and summary of evidence-based public health interventions and synthesized the action items to target it at different roles. It's also important to note that what we didn't cover in this study, which is when MCO should end, for example, and also more importantly, the socioeconomic implications of post-MCO scenarios. We'll get into it a bit later, but this is important because the economic analysis and public health analysis ideally should be understood together.
So I think there's a slide with the baseline. If you wanted to talk a little bit about the model. Yeah.
Yeah, so as I said, this is a mathematical modeling exercise, and we tried to link it to ground truth, which is why you see two lines there. One is what we see on a daily basis for those of us who actively look at the numbers, and the projections that we did, and how we try to make sure that there is the projections are in line, at least to a reasonable extent.
Right.
Yes.
Excellent. Thanks for that, Jan. So as I like you were mentioning, we were thinking that, the MCO was important at that point in time because we really wanted to put the brakes on the transmission, but it was never meant to be a permanent solution. There was a hammer and there would have been a dance afterwards. So since the main intention of the study is to actually raise awareness, especially for the situation that we're in right now, Greg, can you share what are the two key highlights from the study?
Well, before we discuss the findings, let's try to set the context of the discussion. We see that the MCO has been pretty effective in managing the spread of COVID-19, at least from the perspective of not overwhelming our healthcare system. So we think that the MCO has been pretty successful so far, right? But we understand that the MCO also has serious implications in terms of economic livelihood. So this will not be a permanent solution moving forward. There needs to be some balance between safeguarding lives and the livelihoods of people. So in this context, the first finding is that there needs to be a continued commitment of resources to the healthcare system to improve detection, isolation, and treatment. Our model indicates that how fast we are able to detect and isolate individuals who are COVID-19 positive is critical. But it is noteworthy also that this is one of the things that is quite difficult to improve without committing such resources. For example, if we want to increase the number of ICU facilities in this country, the equation may not be so simple as to order more machines. Many things will need to move to facilitate the larger capacity in the healthcare system. We also have to remember that Malaysia spans hundreds of kilometers crossing the South China Sea, and it is likely that what needs to be done in one area would be different in other areas. So this may be a situation where we may need to pump in more money just to observe marginal gains. Now that is the healthcare system. What more can be done? Our next finding is concerned with behavioral interventions on our part. And these refer to the stuff that people like me or you can do to reduce the risk of either contracting the disease or transmitting it. The model indicates that actually there's very little room for relaxation post-MCO. Now, without going into the maths, a decline of about 40% in the effectiveness we've enjoyed during the MCO is enough to shift the dynamics in a way that warrant very strong measures on the part of the government.
That's right. So I guess in a sense, what would you say is the worst case scenario that the model projects if we don't maintain that level of effectiveness, behavioral prevention effectiveness?
Well, I think first we will see a rise in the number of active cases, and every day this number will grow and grow until it continue to impose a stress on the healthcare system. Then it is likely that the government would have to take some strong measures if the healthcare system starts to get stretched. But if it is too late, in the worst case scenario, what we will see is that you will have mass infections and deaths, something like what Italy has experienced. But we think that it would not come to that because the government would step in before that happens lah.
Right.
Essentially, a good way of looking at how to maintain these precautions is to adopt the view that things don't change overnight. What the MCO has done, apart from ensuring that intergroup interactions are limited, is that it gave us this mindset, a sense of urgency in dealing with this virus collectively. Wear a mask when you go out. Wash your hands frequently. When you come home from the market, you have to bathe. Don't touch your face. But the question is, even right now in PKPB, where movement control is somewhat relaxed, we can go to work, we can eat out, are we still maintaining these practices with the same level of seriousness as we did during the MCO? So I guess how this might transpire moving forward really depends on our collective action.
Yeah.
Here in the slides that you've put out, you can see two graphs, one on the left and on the right. They represent our prediction, the model projection of active cases as well as deaths. And you can see that the blue region is somewhere that is quite safe to be lah. If we are somehow able to maintain these practices and keep active cases at the decreasing level, then things would look good for us. However, when we enter the orange region, there is always the risk that that sometime in the future the government may have to take some serious steps.
Yeah, and I think as you point out, like the challenge is also a bit psychological. Every day we're hearing there aren't so many new cases, there aren't no new deaths reported. So it almost seems like we've kind of won this one, and people are really, there's less urgency, as you point out. But the fact is, it is an active period where we need to maintain precautions, right? So since the study clearly highlights the danger of not maintaining precautions, Jan, do you think you could maybe discuss a bit about what the roles of individuals can play? And bearing in mind, an individual is playing multiple roles, right? Like you're a household member, you're a family member, you go to work, you're an employee, you might be a manager, you might be a community leader, maybe even a policymaker. So there are multiple roles, and what do you think that an individual should be aware of when they're going about their daily and working lives in this post MCU, in this PKPB scenario?
Yeah, thanks, Kai. I guess, like you said, the easiest way to conceptualize it is through talking about an individual. So because we're trying to get people to be change their behavior in the medium to long term here. So one way to look at it is to think about your home as generally a safe bubble that we all have, and then some of us or many of us have already started to go to work. And in this process, we're figuring out what is the safest way to do that. How do you get transport to go to work? When you are at work, what's the safest way to manage the situation in this new normal type of environment? And then you're also thinking about questions on a social perspective, such as should you go see your elderly parents or your grandparents? Even though you can to a certain extent, does it mean that you should? Because generally the safest thing for them is to keep within their own safe bubble of remaining at home, and the best way to show your love for them is actually to keep them safe, which is not to go into their home bubble, their own bubble itself. But in general, the way we look at it is that then we all try to progressively grow our bubble and learn how to manage things. So this also applies for the wider society and businesses. And then once we get more confident and handling things safely, we try to grow our bubble bigger and bigger. And then at some point, for example, our kids might start going to school, and then and that changes the dynamics, particularly in the household, to a certain extent, because then you have your working adults and your kids going to school to a certain extent. And it's helpful to keep in mind that within your household, for example, how do you manage the risk level? Because who I meet on a daily basis, I will bring that back to my home. And who my husband meets, for example, is in contact with, will be a mode of transmission from my husband to me when he comes back home. So it's important that everyone is on the same page in the household to understand and manage these risks.
Yeah, that's a really good point, Jen, because I think once we're assuming our house is the safe bubble here, but once people keep on going out and about, that bubble is more in a very unobvious way being compromised, and so it also raises the question of how do you manage risk within the household as well. But that's on the individual level, right? I think the other thing is about systemic things in organizations, because a lot of people are now starting work again. What would you say are the main risks that organizations need to deal with, and how do they go about with that?
Yeah, because as we have eased restrictions on the public health side, it comes with obligations and responsibilities for organizations and the wider society at large. But in terms of organizations and businesses, they've had to grapple with trying to keep their people safe in a way that we've never had to try to think about before. And yes, we acknowledge that working from home is a privilege. But the more that businesses encourage this, it's the easiest way. So to a certain extent, to keep their people safe from COVID-19, although we recognize that it is a privilege and it's not available as a solution for many organizations. But on top of that, it's if we wanted to look at the office environment, for example, yes, we do need to get creative and quite flexible in terms of how do we manage the risk levels at work. For example, there are things that you can do in your workspace, for example, and to keep ventilation good, to manage a disease such as this, and rewiring the social network of the organization where possible, which I think Greg will be able to talk more about on a bit later. But to add on, it's also keeping people, in terms of keeping people safe, we're also thinking about high-risk groups, because we have people who have underlying health issues like diabetes within the organization, and they are a high-risk group that may need extra protection, particularly in this new normal. And yes, the model does highlight that isolation intervention is important, which means how fast you isolate someone makes a difference. Which actually means that yes, testing and contact tracing is important, but from an organization level, it means that the organization needs to encourage people to be able to stay home if they need to and self-isolate, and also to encourage contact tracing when health workers reach out to them, if and when. And from a personal level is to celebrate the people, the individuals that self-isolate if they suspect that they have COVID-19, and actually get themselves tested as fast as possible, because these actions make a difference in terms of controlling the disease from, at least on our end, from a societal point of view. And not to forget community leaders. They are also very important in terms of reinforcing messages and public health precautions that I think all of us have some awareness of.
Yeah, that's a good point. Like the organization, the creativity and flexibility, I think is a really key thing moving forward. And while we've got SOPs and a lot of rules that people need to follow, there's also going to be a lot of teething issues about like how do you actually try to comply with certain SOPs while still trying to maintain the function of that work and all the natural processes entailed in that. But I think it's an important thing to consider. And I guess the other thing that always makes me wonder, when we first talked about reducing risk from this disease spreading in the beginning of the pandemic, there's a lot of confusion about the term social distancing. And people are saying, why are they calling it social distancing? It's confusing. So that later became, physical distancing. And it's very convenient. You can implement it easily, So then when people go out, they just need to maintain about 1 to 2 meters physical distance from each other. And arguably during the MCO, that's okay. That is probably sufficient. But now the interactions are so much more complicated once people start getting back out there and working and taking up social activities. So the idea of social distancing is actually probably the more important thing to address. So Greg, given that you have expertise in studying networks and how that relationship influences disease transmission dynamics, can you explain a bit about this idea of social interactions in the COVID-19 scenario?
Well, one perspective is to view the transmission of COVID-19 through your social networks. Basically, there are 3 things to consider when we think about this. Number 1, people. Number 2, groups, and number 3, environment. And when I say environment, I don't mean nature, but I'm referring to one's surroundings. A good way to describe this is if you consider what your social interactions look like during the MCO versus without an MCO. If possible, can we bring up the slides? So during the MCO, we mainly stay at home with minimal interaction with others, confined to when we do our grocery shopping and whatnot. In a case like this, if you were to get the virus, it would be from a family member, as opposed to someone else you come into contact with outside. And this simplifies contact tracing to a very large degree. However, without an MCO, you would see a social network that looks like something on the left-hand side, right? You are free to exercise your personal liberties. We have to imagine how, in this case, our mixing with different groups of people and being in larger sets of environments may increase the risk of both contracting and transmitting the virus. realistically, everyone would have a different risk factor depending on the nature of your job. For example, if you're a salesman and you meet different people, different groups of people in a day, or if you are not so privileged to have your own private vehicle, you have to take public transport. Or let's say if you regularly attend a religious gathering of close to 100 people in a confined space, all the different the temporal activities that you undergo in one day would determine how the virus spread. If you were to be an active infected, it would also determine where you would get the virus from.
Right. So in that case, I mean, on from practical terms, I guess, what do individuals and organizations need to do in trying to reduce the risk of the impact of these social interactions on the disease spread? I mean, especially since we know there's a lot of people who don't even have symptoms, so they might be, and they possibly can spread the disease as well. So, yeah.
Well, I think part of it has already been addressed by Jen just now. But frankly, I think it is quite difficult to prescribe stuff on the professional sphere, on the professional sphere of things, as what needs to be done can often be quite context specific. It may range from improving ventilation to having flexible work arrangements to setting up operations and facilities to quickly isolate potential infectants on the fly. I guess businesses have various other considerations as well, given that these things you would be limited by physical space, by costs, etc., etc. So it would be best that organizations be proactive in taking care of their staff in these kinds of way, as we have discussed. But I think one of the other things that organizations can do is you can consider how the groupings of people meet every day. So if you work for a large company, for example, it is not likely that a single staff would meet every single other staff in that organization. You would most likely interact within your own teams or within different teams depending on the nature of the project or the nature of the job. And the way that people interact with one another would rewire the social networks in a way which governs the spread of the virus from a social network perspective. So that is for the professional level. On the other hand, personally, let's also think about it from a spatial temporal perspective. I'm using myself as an example. In my case, I spend most of my time at home or at work. So in this sense, my family members and my immediate colleagues are most susceptible to be infected if I contract the virus. And this applies to the rest of my family as well, as they go about their day performing their activities. I think Jen, you also mentioned something like this earlier. So what I'm trying to say is that there needs to be some collective effort, even at the household level as well. Things such as frequent washing of hands, family members, you have to bathe immediately after you come home. We need to take these precautions so that in the event that we get the virus, they don't. And this is how we protect one another, whether we are at home, protecting our household members, or in the office, protecting my colleagues.
Right. Yeah. So I mean there's so much to consider, right? Like yourself and your household, and also what's happening at your workspace, and the fact that it is a contagious disease. You kind of have to constantly think like, what am I bringing out, and what am I bringing back in, or to whichever environment I'm entering. And I think that's where the knowledge of how the disease spreads, real understanding of how it spreads, is actually really important for people to have handy when they try to apply the contextualized practical implications. But the other aspect of risk, I think, is that you're never just dealing with one risk, right? I mean, we're talking about COVID-19 risk for the purpose of this discussion, but when we were under the MCO, we were avoiding COVID-19 risk entirely by having everyone stay at home, but we were also encountering new risks from the MCO, like depression, or in some cases domestic violence, or some people were losing jobs, companies, organizations were losing productivity, and the country was really losing from the economic standpoint as well. So Jen, how can you comment on balancing this need for individuals to maintain precautions to reduce the risk of COVID-19, but also actively taking part in the socioeconomic activities that's so important to reduce the risk on those other things that we just mentioned?
Yes. So basically, what we're trying to do is we're trying to think of it as a way of managing both economic and public health risks together, because both of these need to come in hand to come hand in hand, and to a certain extent they can constrain each other. For example, we've seen the impact of the MCO on the economy, but at the same time, to be positive about what this means, it could also have a positive result. For example, digital platforms and connecting in a way that at a level that we've never done before. That has been a positive outcome of where we're heading. But to answer your question more directly, it does depend on where we are on the epidemic curve. For example, when I mentioned the hammer and the dance phases, if we are in the hammer phase, the strong measures to flatten the curve is important, which because we want to preserve and make sure that our public health system is not overwhelmed. And that is why strong measures needed to be taken. But when we get into the dance phase, we can ease restrictions and therefore try to focus more on economic related measures and make sure that the risks, managing the risks of both the economy and public health are done in parallel. In general, preparing for both is important. From the public health side, making sure that you communicate the risks properly and that your system, public health system is well prepared for this is important. Similarly, from an economic side, is making sure that we know what needs to be done to manage the crisis that we're in. But to highlight for the public health side, it's communication is particularly important because, which is why we're doing this session today, which is trying to explain to people the expected behavior as we operate within this dance phase of the epidemic. And yes, there are a lot of uncertainties, and how we prepare needs to be forward-looking. But at the same time, because the science on the disease, for example, is still developing, and there is no playbook for COVID-19, we still need to be dynamic about how we approach the situation. But in general, living with, because I think a lot of people are trying to grasp with thinking about the new normal and what that means. But just to give you an illustration, in terms of living with pandemics, we already do live with HIV/AIDS. In terms of managing diseases actively, an infectious disease that Malaysia actively manages is dengue. And I think the audience is well aware of how you get dengue, what you need to do. And that is something that we've been managing for a while now. And the timeline in terms of changing behavior, yes, it does take some time, but it is important. And it's also important to note that to avoid elements of stigmatization and discrimination, simply because if the disease does not discriminate, who are we to do that? And I think particularly from an economic perspective, I've seen a lot of analysts try to talk about a pre-vaccine and post-vaccine phase. And I would like, I tend to think of it differently, because we cannot hold our breath and wait for all this to blow over. We shouldn't just wait for the vaccine or for the pandemic to be over before we deal with the issues that we are already facing. the better way to go about is to go ahead, and that is why we call it a new normal, because we do have to live in this new normal.
Yeah, I think holding your breath for too long is never a good option, because then you might asphyxiate, right? But I think it is an important thing for us to think about. Like, COVID-19 is quite special in the sense that it's so contagious. It can be very deadly for a certain group of people, and we don't really have that many tools, and the knowledge that we're having is still developing. And so this is sort of like a critical time point when we decide what are we willing to change and can commit to changing, so that we don't actually run into trouble too quickly before we get more tools, I think. So in saying that, we are sort of entering a new phase in the COVID-19 timeline, because we've obviously managed to flatten it to a certain extent, and under the conditional MCO in PKPB, it's basically restarting the economy phase with SOPs and new normal, right? But for now, one thing that we're still keeping is the ban on large events, large crowds, congregations. And when you say restarting the economy, there's going to be sectors that require technically a gathering or crowds in order for them to function. So a lot of the performing arts are not being able to restart their economy. A lot of deeply rooted social and religious practices can't be continued. Things like Ganduri, things like Semayang Jumaat, Sunday Mass, all those things, we still haven't figured out how to do it safely, right? But in the event that it becomes acceptable, as in it is actually legally allowed for social events or gatherings of a certain number, 30, 50, 100 people, and let's say they say with SOPs in place, can you comment on what is the risk for an individual when they're, or rather, how would they decide on partaking what is actually allowed, but we will say has its own risks? Greg, if you could comment on that.
I would say that this is just my opinion. Yeah, I would say that allowing for such social events at this point in time may not be a very good idea, lah. Basically, because we haven't really got. I mean, the health profession haven't, as a whole, we don't really know how to behave during a social event in a way that we would be able to contain the transmission of the virus. Some of the simulation models which I've come across suggest that the larger the number, the higher the risk of having such an event. But if I read the models right, it really isn't about the number, but rather the dynamics of something called clique percolation. So in network science, this refers to how different communities, i.e. groups of people, how they overlap. So if you consider an event like a wedding, for example, it is very natural for us to want to shake everyone's hand, to catch up with friends which we have not met for ages, to get to know new people, etc., right? And it is precisely these activities that rewire the transmission pathways that heighten risk for everyone. So it's quite difficult to give an actual number. But I think what I'm trying to get at is that it is the way to think about it is to think about how we interact with one another and how.
Get me outside alone. Bye. Sorry,
We have
Greg.
a little scientist there, Kai.
We'll lock the door now. Okay, sorry about that. Yeah.
Okay, sorry, I lost my train.
Weddings, you will have this basically happening. Guys, can you
At weddings, right?
Yeah.
Yes. So at weddings, there are certain things that we do which heighten the risk of transmission, and I guess we haven't really thought of how we can continue this behavior. I mean, it's quite difficult to say, okay, in a wedding you don't shake everyone's hand, you don't catch up with friends which you have not met for ages, you don't get to know new people. It's quite silly, right? but we haven't thought about how we are able to do these things without heightening this risk. So I guess it's going back to Jan's example just now, you would want to enlarge your bubble in the sense that you would want to enlarge your degrees of freedom when you have figured out how to manage them, but not before.
So still too risky for now. But I think you raise a good point. Like, I guess it's really not just about the number, it's about possibly even the setting. Like, is it a place that is going to be more risky? Is the activities entailing more risky as well? So but in any case, you would, I guess I would certainly be very cautious about taking such risk, even if we were allowed. But I think it's an interesting thing to think about, because even when the recent Raya, we were technically allowed to have a certain small gathering, and it was really up to us to decide whether or not we want to take that risk. And in the future, there's going to be more of these, I would say, dilemmas, right? About should we do what we can do? But what would you say is actually the risk of such numbers of crowds actually sparking another wave? I mean, is the model... I took away. Can you give me 1 second? Guys, let me get out. Just continue without me. Guys.
Yeah, Greg, would you like to answer the question? Yeah.
So I guess we didn't really go into much detail in our write-up, but in our model, we did try to simulate the event of a super spreader. Effectively, what happens when we, let's say in a social event of this nature, if we were to increase the risk, if we were to heighten the risk of viral transmission for everybody, you would have a similar cluster to the street battalion cluster. And that is something that you would absolutely want to avoid. I would say that the risk of such an event is quite real, because we have not nailed down how to manage these things yet.
Right. And it's...
So at this point in time, I believe that if a social gathering can be conducted online, then just do it online lah. I mean, it's for the safety of everyone, and we still get to meet each other and have this nice conversation, right?
Yeah. So I think, again, the whole idea of creativity and flexibility. So gathering doesn't necessarily just mean a physical meet. And I remember reading in the news about some gamers recreating a Malaysian wedding. I don't know, that could end up being like a new norm thing, where you actually pay a service to have, role playing, what is it, GTA, or I don't know. But this whole new normal thing actually relies on a lot of tools, basically, and things like having sanitizing equipment, disinfectants, masks. All the shops that we go through now are taking our temperature, so those things now suddenly are in high demand. So Jan, in the beginning of the outbreak, so you released a discussion paper on trade during a pandemic, and some of the items that Malaysia uses in dealing with COVID-19 is heavily imported, right? So can you talk about the trade angle, and what's the dimensions on ensuring that we have enough supply to continue managing the risks in the medium and long term?
Yeah, thanks, Kai. So the good news is that Malaysia is among the largest exporters of surgical gloves in the world. And so that's one less thing to worry about. Where we would probably start to worry is the items that we do not produce domestically. Unfortunately, that was outside the scope of my study. So I focused on the trade angle, which is the export and imports of the products, looking at medical supplies specifically, which is a list of items that is seen to be needed for COVID-19. And in 2018, it looks like we imported approximately 9.5 billion ringgit worth of these medical supplies. The top 5 importing countries on these products are the US, China, Germany, Singapore, and Switzerland. Interestingly enough, 47% of those imports is on hydrogen peroxide. I'm not entirely sure what that does. I know it's used and it can be used as a medicine or, for example, an antiseptic, but also to keep in mind that for trade data, the limitation is that we're looking at categories of items. And so in general, Malaysia has done quite well in terms of making sure that the import taxes, for example, or more technically known as tariffs, are at a minimal or zero for most of the items, except for maybe a few categories for items, and I think another element, at least on the general global trade side, is to keep in mind that different countries are on different phases of the curve. That the impact on international trade and the impact on us understanding what that means from a international trade perspective is that factories may temporarily close down for different countries in different points in time, depending on how they are dealing with the epidemic. So, for example, we're looking the World Trade Organization has come out to say that they're looking at a recovery, at least on the global trade side, in about 2021.
Yeah. I feel like adding. I mean, I really apologize. The risk of having a lot of these online things is my my stress levels go up very very rapidly, very suddenly. But I guess it seems like the supply side is not something that we need to be too worried about. Although it does seem like a lot of the countries we're importing from are struggling with the pandemic a bit more than we are. So something to consider as well. Like, are we domestically? Yeah.
So I guess the point is that some countries have gone out and blocked the exports of these medical supplies, and for they've also done it for food to a certain extent. But in terms of Malaysia, it would be looking at the countries that we actually import on and the items that we import on to see whether or not there is a risk there, and comparing it against our domestic production. To my knowledge, from what I'm hearing from statements made by the government, is that getting enough supplies for medical supplies doesn't seem to be an issue or on the top of the list of things that people are that they are worried about at the moment, which is good. But it is something to keep in mind because as countries deal with this pandemic, they would be inclined to try to protect their people first.
Yeah, I mean that's a fair point, and I think that's all the questions I have for the panel. And I think there's one question right now, actually a couple of questions. Maybe we'll take this one from Sean King first. Thanks, Sean. So Sean's question is, based on WHO phase of pandemic, can your data predict when we will reach the post-peak and post-pandemic stage? And will your data provide an optimistic timeline to resume economic activities as usual? Maybe Greg, you want to take this one?
Okay, thanks, John, for the question. I think it's a good question. So because the paradigm that we have adopted is system dynamics, and in system dynamics, we don't generally come up with a prediction. Not because it can't, but rather because the mathematical modeling is stronger if in answering the question of if. And I do think that the question of if is more important than the question of when. So there are two things that we have to bear in mind here. One, if we do not control this, we would see a situation like Italy. But if it is under control and you see the number of active cases reducing on a daily basis, then this disease would eventually disappear over time. So in answering the question of when, you should first answer the question of if, right? So if people don't really maintain these practices to manage the transmission of risk, it is very likely that we will see another surge in the number of active cases, and this is something that progressively would happen, and the probability would always be there. So I guess this is the, I mean, I hate to be the bearer of bad news, but this is the new normal. And in this new normal, it would be wise for us to just adopt some new practices in order that we can maintain some of our past personal liberties.
Yeah, I mean, I think that also sort of answers the question that Rusdi Adi or Adi has asked about how long until we can do the last dance. I think people are, we kind of, it's tiring to maintain a lot of these precautions for sure. So what the data is, I think if I understood what Greg was saying, the data is not, I don't think any model would be able to predict the true long-term impact, but it's more about what are the possible scenarios. So what are the things that we need to be conscious of. So I think maybe I'll take.
Sorry,
Yeah.
can I add on?
Yeah.
It's also a vaccine. So generally, I think the view that we've taken is until you get a vaccine, we do have to learn to live with taking as much precautions as we can, because that still seems to be the best case scenario for the time being. Do you agree, Kai?
Yeah, I mean, like I said, there's a lot of diseases that have come and gone, and a lot of it relies on certain either structural changes or new tools that we have, vaccines being one of them, or better treatments, so that we're able to reduce the death likelihood from getting the disease. But at the same time, there's a lot of things that are so unknown about this disease, this pandemic, and how far-reaching and how rapidly reaching it is, that it's really hard to make any calls on when. But it's more about what can we do and what should we do within this phase that we're at right now. So there's a couple more questions, and I think it's more on the practical side, right? Maybe. So we'll go with Jay's question first. Thanks, Jay. So the question that he has is preschools and daycares are reopening now. So how is the risk assessment and safety precautions taken for such scenario? Because many parents are skeptical to send their kids. Yeah, I feel you there. Yeah. Jan, did you want to maybe start on this one?
I guess this is definitely a hard one because it's not as if we can tell toddlers to wash their hands and not touch their face all the time. So the public health precautions needed is not easy to implement. But some countries do think that they can do it. For example, Denmark has already tried to open up their preschools, if I'm not mistaken. Yeah, so some countries have tried, but I cannot say what the best way forward for it is. Kai, do you want to add?
Well, I think, bearing in mind Denmark is quite different from Malaysia, and the nature of the daycares in Malaysia, there are a few things, right? Because when our daycares are a lot cheaper than you'd say from a lot of the high-income countries, because we tend to cater for more children in one space, and that's something that I think the service providers are grappling with, because the parents are now required to come back to work, and the parents that aren't required to come back to work are still paying for the service that they technically are scared to use or not allowed to use. So I think it's a really difficult thing to actually answer, and I realize I'm not answering it, but I think right now the best thing you can do to actually reduce the risk is, if you are able to keep your kids at home, you would do that. That's my personal opinion, but of course not everybody can do that. But once you have the people able to do that, doing that, you just reduce the numbers, and that makes all these other precautions that people need to take within the daycare space more feasible. Because if they have to deal with a lot of numbers, because everybody who's thinking, okay, I can send my kids now, so I send my kids, that makes it all challenging for everybody, and it kind of elevates the risk for everybody. So again, there is no one size fits all, and it's going to vary from daycare to daycare as well. Like the setting itself, is it is it a house daycare? Is it an open space daycare? All those ventilation factors, I think.
Sorry, Kai, I do want to add that I think, Kai, we've had this conversation before, in terms of if you're having kids and you eventually want to be able to bring them out, at least to exercise, for example, at some point in time, which means that we need to educate our kids and prepare them for the outside world, as hard as it may be. That would probably help the kids in terms of managing this environment also.
That's a good point. Like even I think one thing that we can try and model even in the higher income countries with I guess smaller ratios is the way they try to integrate the preventive activities within the day. So it's not so much about trying to complete certain workbooks. It's actually doing certain things that adheres to the social distancing precautions. And I guess because it is daycare, I think, and even to a larger extent, maybe it's a time we think about what we need to achieve within the day of schooling as well, or within a term of schooling as well, and embed a lot of the precautions and risk reduction as part of the daily activities. It's a tough one. So maybe I'll take one last question. This one's from Aizati. Thanks, Aizati. So her question is, so far the government has been doing great in terms of SOPs and guidelines post-MCO, but the implementation heavily relies on public understanding and uptake. How well do you think our public is aware on the importance of adhering to the SOPs, and how fast would Malaysians be ready to uptake the new norm? I'm going to open it up to any one of you who wants to start first. And so how well do you think our public is actually aware at this point in time?
I would say that's why we're doing this session now. We're trying to increase people's understanding of what it means to live in the new normal, rather than just following SOPs. Sessions such as this, we're using it as an opportunity to help people make their decisions on a day-to-day basis, and hopefully, as time goes by, we get better at it, particularly as a society, because this can only work if the society as a whole takes responsibility for this. Yeah.
Do you want to add on anything, Greg? What have you observed in terms of public understanding and uptake of the precautions, or rather the SOPs in the new norm?
Mm-hmm. So at least in the beginning, I believe the public has have practiced the basic things well, like wearing masks, frequent washing of hands, etc., etc. I think some institutions and organizations have took things a bit further, and they have relooked at the way the office is organized, what systems needs to be in place in order to sort of manage risks and live in this new normal. However, anecdotally, I feel that there is a bit of lax in terms of adhering to the SOPs. So for example, if you're walking, let's say I'm walking in KL Central, and I can already observe that a few people are not wearing masks. So but this is just anecdotally. So I guess it is quite mixed at this point in time. It depends on who you look at and where, I suppose.
Yeah, I think the other thing I would comment on is, as much as possible, we don't want people to we don't want to rely too much on people understanding some things, but kind of enable them and make it the norm. But at the same time, because you can't anticipate every single situation that a person might encounter. This is why that awareness of the way you think about risk is really important. And I would say what I would be what I've observed is that people will latch on to certain SOPs without really understanding the nuance of the risk. And I think that's what really I would like to get out there more. I mean, it's not just about complying to the SOPs, it's about understanding why they're there and how they work. Because if you need to change them, you can do so with understanding of how that changes your risk in that situation. So how fast would Malaysians be ready to adapt to that? To be honest, it's not just Malaysians, because human beings are not wired to think about risks like that. We usually respond when something's happened. We don't anticipate what might happen. But I think we will have to see how things unfold in the next few weeks, few months. And ideally, we are okay, but sometimes it takes another jolt for people to suddenly realize it's really important that I take certain things. I don't know. We've actually already run out of time, but there was one more question. Shall we take it, or?
Yeah, I can take it. So basically, the question is on how long does it take to get the economy boosted up again? I can tell you, so I was on another discussion with economists not so long ago. And so they are also doing it on a what if scenarios because there's too many variables and to try to take into consideration, and because we're also dealing with public health considerations. If the public health one can fluctuate, the economic one can also fluctuate, and so it's also a scenario planning type of situation. It's not a this is how it's going to be like, because there's too many elements to take into consideration. And then it's as we go along, we're seeing, oh, this, it looks like we're working in this scenario, and therefore the economic measures that we need to take would be A, B, and C. But yeah, sorry, no, yeah, if I had a crystal ball, I could tell you, but yeah, sorry, no.
Yeah. So yeah, thanks a lot for all the questions, everyone, and thanks the panelists for making the time to be with us, and which I think really it's about sharing that awareness as well. You know, the SOPs are there, but it's our individual effort at understanding what we need to do to assess our risk and how to manage it. So I hope that's been a fruitful discussion. And in the meantime, I think this is a test for us. And, you know, some things we will have to sacrifice and some things we just need to do differently. And I think it's understanding that, you know, the more time we buy, the likely that we'll have the tools to even better manage this in the future. So let's not run into a new wave too soon by not taking the precautions. So with that, I'm going to pass it back to Taiga, and I think there's going to be a link to the survey.
Yep. Okay, thanks, Kai, and then the team. It was a very interesting and a fruitful session. So the last question actually is from me. Actually, I want to know like which industry going to bloom after the after this MCO.
Which industry?
Yeah,
the one that can recreate weddings in GPA.
Yeah, probably that's a very good answer though. Let me okay, can you see this? Yep. Okay, guys, I think thanks again, Kai, Jan, and Greg for a wonderful discussion. So I think I let you guys go now, but then stay online. I get back to you after 5 minutes after the survey. Okay. Okay, audiences, thank you for staying up with me for an hour, for nearly an hour plus. Okay, guys, so that's for today actually. So I need a favor. So all the audiences, can you guys please attempt the survey so we can get your feedbacks, and then we can improve our further sessions. So thank you again, and thank you very much, and have a good day. So that's all, and then bye guys.